Hi, I'm Sarah Clark with Disability Counseling Institute, and I'm going to talk a little bit about language with disability. So, oftentimes there's confusion between person first language and identity first language. And over time, the general positions on these things have changed. So it's important to be aware of what's involved in knowing which to use under which circumstances. The general guidelines are to work with people based on their own language and identify how they want to be spoken to and how they speak about their disability. So let's start with what the two different types are, and then we'll talk a little bit about which one to use in which situations. Person-first language identifies the person before the disability. So when we're talking about person-first language, you would use phrases like a person who is blind or visually impaired, a person with a spinal cord injury, a man with a traumatic brain injury, a woman with a epileptic disorder. So we always identify who the person is prior to identifying what the disability is. And this is something that many people believe is the best and only politically correct way to talk about disability. However, even though it is what is used most generally, there are other language types that certain people or certain disability culture groups prefer. So one example of this is deaf people. And I hesitated before saying that because I'm in the habit of saying people who are deaf, person first. But deaf people prefer identity first. They choose identity first language for a very specific reason, because it fits with their cultural beliefs. That doesn't mean that every person who is deaf necessarily wants to identify with identity first language, but that's the general rule of thumb. So that's what you can start with, and then a person can correct you. But deaf, sometimes capitalized with a capital D, people do choose to identify their deafness as part of who they are, and it's part of how they interact with the world. They do not view it as a disability in the same way that somebody with a medical impairment, chronic illness does. It's indicative, their language choice is indicative of how they view themselves in relation to society. There are other groups of people with disabilities who prefer identity first. And again, this is just generally speaking, but not everybody within these groups feels the same way. But autism is another group where people usually prefer identity first language. So instead of saying a person with autism, you would say an autistic person. And again, it's because they feel like their autism cannot be untangled from who they are. It's part of their identity, and they want to acknowledge that it's part of their identity and not treat it the same way that we would talk about people with medical conditions and chronic illnesses and, certain other disability types. So again, there's always exceptions. Treat people the way they choose to be treated. Talk to them the way that they talk about their disability, and use their terminology as much as possible. Or if you're unsure, just ask. A well-informed provider will know that it's okay to ask, do you prefer person first or identity first language? Do you prefer certain terminology? There's There's a lot of people who would prefer to be called blind versus visually impaired, and some that would be adamantly opposed to that and prefer the opposite. The same goes for hearing impairments. Hearing impairments and deafness are not the same thing when it comes to disability culture. Yes, the same part of the body is impacted, but people who identify as hearing impaired will not be comfortable with the term deaf. And deaf people do not acknowledge the term hearing impaired because, again, impairment denotes disability, illness, that there's a problem with the person. So choose whatever language you're going to use based on who you're speaking with and what disability culture you're speaking about. And that will help you make the decision of what language, what terminology, what phrasing to use in order to be a disability aware provider. Thanks.